Okay, my name's Megan Garrity. I'm a licensed clinical social worker and I specialize in LGBT trauma and addiction.
My name is Kelly Schwarn. I work with the LGBTQ population majority. Most teens is my favorite population to work with.
So what I believe to be is affirming therapy is when you're not just supportive, you affirm and you validate what they're saying and what they're feeling, and you're very open with them, so they feel comfortable in telling you, what they're actually feeling and thinking. Because a lot of the time, sometimes with families and society, it's not. I mean, it's unaccepted in some, cultures, some families. So it's a place where they can come and be safe with someone that's non-judgmental and
kind of figure out who they are without the pressure of other people and what society thinks they should be. There's a lot of people that still don't super accept people in the community. Things are a lot more improved. A lot of schools cover that kind of material. But even so, there's a lot of areas where that's not acceptable. Rural areas, that's still really frowned upon. And so they face a lot of judgment, and in certain states they could be sent to like conversion therapy. Mm-hmm. It's just not always a safe, welcoming environment for them, even though legally things are starting to improve for the community.
I mean, I think it can be powerful just in the fact that they're in a safe space to talk and then, feel safe and validated and supported. Overall, that's extremely powerful.
I think a lot of because a lot of parents are like overwhelmed, they don't know what to do or how to be supportive for their child that has come out as some facet of the community. So a lot of it is like asking questions and being okay with not knowing and getting information. I think it's important for parents not to make assumptions and kind of just go by what their child wants, not necessarily what the internet said you should do. And just making it more personalized care and just giving them the space to figure themselves out.
As the age gets older, the resources become more limited. So in high school, there's resources, they have a community there. Really a lot of the times with the LGBTQ community, it's, you can go to gay bars and gay clubs, but really there's nothing else other than maybe like a PERSAD, one community center that does limited events. So I feel like as you age, it's hard to fit into a certain space in a way. Would you say that?
Yeah, you lose a lot of the sense of community because it's called the LGBTQ community. But as you get older, it's a lot more sparse. Mm-hmm. People have their own like adult professional lives that they have to be a part of, and they don't get to identify with other people in the community. And then as they get a lot older, and now they're like in nursing homes, mm-hmm. Nursing homes aren't really equipped for taking care of queer needs. I think society has their idea of what members of the community should be like or look like, especially like for like the way that we present. So some people want to be more masculine presenting, and other people want to be more feminine presenting. And there's a lot of expectations, like say for the trans community, when they come out to be like ultra feminine or ultra masculine.
And look a certain way and be able to, pass. And pass meaning pass as that
gender that you identify.
Yeah.
So there's just a lot of pressures. And then you see now there's like more queer people on TV, but they also are pretty all cast from the same mold. Yeah. The gay women are either super masculine or super feminine, and there's like no middle ground. Gay men on TV are always super feminine, and we never get to see like masculine gay men on TV. And our trans representation on TV is just so minimal. Mm-hmm. So there's just a lot of expectation even coming through the media, and that's what people expect to see when they encounter people from that part of the community, and that's not necessarily accurate. So I think in the past, what the community faced a lot in therapy were therapists questioning if what they were saying was accurate. A lot of times they're like, well, this could be a phase. Are you really sure? Nowadays, that's super frowned upon. So most therapists that are worth their salt should not be doing that. Conversion therapy is super frowned upon now. But I think clinicians are just getting more aware of the issues and needs of the community. And even if they're not specific for that community, they know how to approach their clients and meet their needs.
And ask questions. And I think that's a big thing for therapists that aren't, if that don't specialize in the LGBT population, is to just be able to ask your client questions, because that's better than assuming or guessing or trying to, figure it out on their own. If you're just open and honest and genuine with your client, I believe that a lot of times the response has been very positive, and they'll understand that because we're human.
And most clients are willing to teach if you don't understand, as long as you're open to being taught. I think in addition to the other parts of the question, is like you can make the space more welcoming. Usually having like just a little tiny pride flag in your office lets queer people know that it's safe to be themselves in that space. Having stuff in like a waiting room might be nice. Resources, because a lot of the time people don't have resources that they need, and so a therapist should be able to supply that for their client, because it's part of what they need to survive.
And personally, I have in my door, like, when you walk into my office, there's just a tiny LGBTQ sticker, rainbow sticker, and that's just, they see it and it's like, okay, they're cool. We can just have a safe space, and it's just them reassuring them that, this is a safe space.
Yeah, I think a lot of people in the community come into therapy somewhat closeted because they don't know the response they're gonna get. And having just a tiny little thing that says you're a safe space allows them to like relax and just be who they are without worrying that the therapist is going to judge them. I think it is a huge respect thing to use the pronouns that someone is asking for, because it's like a basic human right to be addressed the way that you want to be addressed. And I think a lot of people make it more than it has to be. And you don't necessarily have to understand or get it in order to be respectful and just use them because someone has asked you to. We don't always understand all facets of a human being, and we still respect who they are. So doing that is also really gender affirming for them, because you are seeing them the way that you have asked them to. It's really disheartening for people when their pronouns have been expressed and then people don't use them. They're not like necessarily going together, because people can identify as one part of the community and not identify as another. So gender identity can be trans people in the community or even intersex people in the community, and the way that they express themselves versus the sex they were born as. But that does not necessarily mean they identify as gay or a lesbian or just queer in any way.
Gender is separate from sexuality.
There is a big divide.
Divide, I would say, yes, a divide. And I think people do get confused with that.
Right.
Because they assume that if your gender's one thing, it all goes under the same umbrella as being, your sexuality. And I think there is two different, concepts of it.
And while I think that a lot of people that do identify as a gender different than they were born as, a lot of them do identify with the community and have a sexuality other than heterosexual, but that doesn't mean that all of them have that. So it's just kind of respecting where people lie on the spectrum of the community.
I think being accepting and open and affirming and non-judgmental and, just listening. I think listening is one of the most powerful things. To be heard is what everyone really wants, right? We want to be heard, and in that, being heard is so supportive and it's so almost easy. You just listen, and I do believe that empowers the individual, especially if they're having a mental health crisis. Especially if it's about either sexual orientation or gender, because there's a lot of struggles there, and for family and friends to be very supportive and non-judgmental.
Validate what they're going through. Don't diminish their experience.
Don't say it's just a phase. It may be just a phase. Like,
Right. Just take them for who they say they are. It's not really necessarily something for debate. And also, you have to like advocate for your child, because we see it in the news a lot with like kids that are like genderqueer, and we see that like in the classroom things aren't respected for their identity, or in the bathroom it's a huge problem. So it's advocating for your child and their right to exist as they are.
Being accepted by your family, not being disowned, that fear of being disowned and not being homeless, essentially. I mean,
there's also like a spiritual struggle because a lot of religions frown upon it. And if you're someone who identifies strongly with your faith, that can also be a sort of contention for you, because a lot of religions say it's not okay.
And you will suffer and go to hell, and for the rest of your life. So there's a lot of powerful beliefs that when coming out, it's a big stressor.
And it's also a stressor depending on what part of the world you're in. In the US, generally, we're better about being queer, but there's several countries where that's illegal. And so just being yourself is literally a crime. I mean, until a couple years ago, being gay was considered a mental health diagnosis.
Right.
So there's just a lot of stressors that they face. There's not a lot of resources. There's a lot of ignorance. So even if you're not kicked out, you still face a lot of adversity.
Positively, I believe it can, because you can reach out and find support, because there's a world out there, the internet world, and you can find really whatever you're looking for if you're in support. Negatively, I believe, and I've seen that there does have to be human interaction, I think, for this world to be functioning. I mean, we've seen it, with iPads and screens and all that. Like, people have a harder time communicating face to face and get anxiety going back to school because, all of that, like with COVID, and like it's a harder time integrating back in. So I do feel like, yes, it's important to have an internet, world for support. However, I do believe there's a strong need for more support in the actual community face to face, with events and things that you can actually meet and see someone and talk to them in person. Personally, I'm not from Pittsburgh. However, I've been here for about 8 years, and I've, lived in different cities, and I do believe Pittsburgh does have somewhat of a community. However, it is still, I believe, limited. There's not like a place where you can go like this town is the town where queers hang out, or, it's known for this, and a lot of cities that I live in have that space where all the restaurants are gay owned, all the shops are gay owned. That's where, queer people feel the most comfortable. Here, I don't see that. And I know PERSAT is one of our biggest supporters.
They provide a lot of queer services that other people don't even mention. But
and we have Pride once a year, but other than that, I don't know much.
And our Pride has been growing every year, which is great. And I love to see them at the parade, and the parades keep getting bigger and bigger, which means our community's expanding and people are more open and more comfortable. But I think that Pittsburgh still struggles a lot with making it a more comforting and welcoming place for the community. So other than on Pride, you don't see a ton of the community out and about. And it's really the only time of year that community gets together in Pittsburgh, which is a shame.
Well, I think especially in rural areas, like rural PA, it's very, segregated, obviously, small. And there's not a lot of, resources out there in community and people, where they feel safe, because it is a small rural, there's a lot of small rural areas in this state, I don't know if you have any.
Yeah, and there's not really a sense of community in those rural areas because there's not a ton of other people that are openly gay in the area. You might go to a school that only has one openly gay kid because it doesn't mean they're not there. It just means they don't feel safe. And there's just no resources for them. So it's very isolating. which is really detrimental to everyone, but for the community specifically, because we just face so much adversity that having mutual support is really important.
Ask questions. Bottom line is ask questions, I believe. The more open you are and the more, we're human. We're not going to know everything. And so I think if you do show that you're genuinely caring and open and honest and asking questions, I think that's one of the biggest things.
I think the main thing that you want to avoid with the community is making assumptions. Because assumptions are going to get you shut down by someone real fast, because that is going to offend them the most if you're just assuming something about them based on their sexuality or gender identity. It also allows them to be like their own expert and teach you. So just be open to the fact that you don't know everything, and that's okay. Like, you can look up online for providers, and a lot of them who are gender affirming doctors and therapists, they will list that they are. But that requires like a lot of self-searching and discovery,
right?
Because it's not super marketed. Other than Persad, like, there's no one place that markets that they are for the community, which is difficult, and it causes people to feel kind of lost and dejected because it's not super easy to find.
And there aren't, I know from experience in Pittsburgh, there's not a lot of LGBTQ, therapists, right? So in the community, there's not a ton. So when they do call to get, services, there may be a wait list of 6 months.
Yeah.
So, and people do sometimes feel more comfortable with a therapist being a member of the community, I believe.
Personally, I would prefer that, just because it's like I don't have to worry about their perceptions as much,
stigma
or any of their expectations for what I should be like or what my life should be like. Education. I think they need so many trainings. I'm in the community and I still take a bunch of trainings on it because you don't know everything.
And it changes frequently at times.
And what I like doesn't mean other people like that. So you have to be able to adapt to time. But I think especially older providers really could use help even with like terminology, because terminology is changing frequently. Slang changes all the time, and the younger members of the community are going to use that so much. And I think getting more educated is super important, because more and more of our youth population identifies as something other than straight and cisgender. Gen Z is the most openly queer generation we've ever seen.
Right.
So it's good to be on top of the issues that they're going to face. So sex is the biological sex you were assigned at birth. So you were born with these chromosomes and these organs, and so you were defined as a boy or a girl when you were born. Gender is how you identify personally, regardless of the genitals you were born with. It's how you present yourself, how you carry yourself, how you view yourself, versus what you were assigned when you were born.
Gender identity is about gender, and sexual identity is about who you are attracted to, and it could be different or the same.
Being part of one doesn't mean you're a part of the other. It doesn't write off the other part either, though. And gender identity, a lot of people that have a gender identity outside of what they were born as, it's still a pretty even split on if they identify as gay or a lesbian, or if they identify as heterosexual. They're just really separate. And I think a lot of times they get grouped together, even though they don't necessarily go together.